I'm Latham Thomas, founder of Mama Glow and the Mama Glow Foundation, and I'm pleased to welcome you to the Maternal Health Advocacy Program brought to you by Carol's Daughter and the Love Delivered Initiative. In this two-part training, you'll be learning about advocacy from a handful of incredible experts. Now let's set the stage. The United States has the worst maternal mortality rate in high-income countries globally, and the numbers have only grown. When compared to white women, Black women are more than twice as likely to experience severe pregnancy-related complications and nearly 3 times as likely to die. Black birthing people are also more likely to experience life-threatening conditions like preeclampsia, postpartum hemorrhage, and blood clots, as well as increased incidence of other pregnancy-related complications like preterm birth and low birth weight. These severe maternal health issues have significant short and long-term consequences to Black families' health and well-being. Black women's autonomy and health has long been threatened by institutional and interpersonal racism. For generations, the safety of Black women has been undermined by healthcare systems that are entrenched in racial bias. Medical racism manifests in inattentive healthcare, disrespect, and false beliefs about biological differences between Black and white bodies. This is a public health crisis for all people. The discrimination and poor treatment experienced by BIPOC birthing folks ultimately harms everyone, and their health status is a reflection of the health of the entire community. Black birthing folks deserve to exist in safe and empowering communities that honor their bodily autonomy and provide them with the care that they deserve. To improve Black maternal health, we must all come together and demand change in the communities that we live in and the systems that we engage with. We must commit to creating a world where all people are able to safely give birth and access quality reproductive health care throughout their lives. The Love Delivered Initiative is a collaborative effort between the Mama Glow Foundation and Carol's Daughter that seeks to bring increased awareness to the Black maternal health crisis and shine a light on ways that Black birthing people and their families can be empowered before, during, and after birth. In this video series, we will aim to provide families and community members with tangible tools and resources to support birthing folks in medical settings. We define advocacy as strategic action taken to advance and protect causes and experiences that a person believes. Through advocacy, people are empowered to use their voices to protect their rights, make their opinions heard, and advance social justice. We can think about advocacy in 3 buckets: self-advocacy, individual advocacy, and systems advocacy. Self-advocacy is your ability to speak up for yourself. In order to be a self-advocate, you need to identify your needs and goals, understand how you want to be supported by others, and clearly communicate this information to them. You can improve your self-advocacy by getting to know yourself and your desires, educating yourself on your rights and responsibilities, and continuing to communicate your needs to others. Individual advocacy is when a person advocates for a single individual or group of people. It can be formal or informal. Informal advocacy typically involves family members and friends advocating for a loved one. Formal individual advocacy typically involves informed community members and organizations that are trained in navigating social systems. And then systems advocacy is rooted in promoting large-scale social change through advocating for change in goals that negatively impact how someone lives their lives. Systems advocacy can be done by individuals, small groups, and professional organizations or coalitions. Every tier of advocacy works together to build a better world for all people. Maternal health advocacy is specifically focused on ensuring that all birthing people receive safe and respectful maternal health care that is responsive to their individual needs. We must engage our leaders, healthcare professionals, and community members to hold stakeholders accountable and ensure that all people receive the care that they deserve. Advancing maternal health advocacy requires centering health equity and birth justice. Advocacy is most powerful when done in community. We all have a role to play in solving the maternal health crisis and building a world where all people receive respectful and responsive care. Doulas are trained professionals who provide emotional, physical, and educational support to birthing people and their families before, during, and after childbirth. doulas advocate alongside their patients by providing them with evidence-based information, allowing them to make informed decisions about their health. During the birth, they support the patient's birth preferences and provide hands-on comfort measures and facilitate communication within the care team. As family members and friends, you are also important advocates for birthing people, both inside and outside of the hospital or birthing place. Learning about key maternal health issues and tangible ways to support and honor birthing people's needs and desires will make you uniquely qualified to advocate alongside them and ensure that they have the best birthing experience possible. Beyond individual advocacy, there are many more ways to advance maternal health. This training is an invitation to continue to involve yourself in community-based maternal advocacy, and there are many organizations working to address maternal mortality in this country through campaigns and to raise awareness and creating support spaces and more.